Oh, goodness. Okay. Hello, everyone. I'm Dr. Angela Owens. I'm a nurse with a doctorate in healthcare systems leadership, and I'm an executive coach. I want to welcome you to the September edition of the Doctor by Doctor Coaching Group's webinar. We are a group of healthcare doctors trained as coaches, and now we coach other healthcare doctors and leaders in the clinical and industry settings. We will be coming to you on the fourth Wednesday of each month with a topic in healthcare coaching. Today, it's my pleasure to talk with Dr. Heath Jolliff. Heath is an emergency medicine physician and a medical toxicologist, and has been in clinical and academic medicine for more than 2 decades. He is certified as an executive coach through the Center for Executive Coaching and the International Coaching Federation. He's also the founder of Physician Coaching Solutions, where he helps physicians to optimize their current careers or transition into new rewarding non-clinical careers. For our viewers who stay until the end of the webinar, Heath will let you know how to get a free consultation with him. And with that, Heath, welcome to the show.
Thanks, Angela. I appreciate being here, and it's great to be on the opposite side of the desk.
Yes, good to see you there too. So for today's format, Heath will start with some introductory comments, then I'll follow up with some questions of my own. And lastly, we'll move to your questions from our chat. And remember, it's never too early to start typing questions using the chat icon at the bottom of your screen. So Heath, take it away.
Thanks, Angela. So we're going to talk about a topic that's on a lot of people's mind is basically coaching through a career transition, how to do that successfully. So the one thing that I'm going to talk about today is what should you know before you even attempt to transition out of clinical medicine? Also, what non-clinical careers are available to doctors and physicians? And then lastly, what's the role of a coach in a career transition to help you be more successful? So the first thing I want to talk about is kind of my story, like how did I get here and how did we get here in the first place? So one of my colleagues, Dr. Dyke Drummond, has a thing that says, if you take a mid-level career physician and ask them to tell you about their burnout story, they'll often say, which one? And honestly, I don't think I really knew what burnout was until just a few years ago, but I know I went through it, even though I wasn't sure what it was back then. When I look back at it, I think a lot of this starts when we're in medical school itself. You're really excited to be a doctor, but just like so many careers, you get started out and you're doing a lot of book work, lectures, a lot of time studying, exams, just constant. And I can remember thinking, when do we see patients? And that kind of went on for a while. And then you start learning some what I consider not so great habits. You're really competing sometimes in an unhealthy way against your colleagues. We used to have this thing called the wailing wall where they'd post all of our test results and you would look up there, and even though it didn't have your name, you had a number that you looked up, you could see where you fell amongst all those people. So it was always this, what I considered an unhealthy competition amongst folks. And then you start doing things like you don't sleep as well, you're up studying all the time, you're not eating so good, you're eating potato chips and pizzas and stuff like that. You give up a lot of really healthy habits, like you're not exercising like you used to. You're not taking a day off on a Saturday to go hiking or doing something you really like, not taking vacations and things. And those things kind of build up a little bit. And they can turn into a really bad habit as we get older too and advance farther along in our careers. I had to take a big pause between my second and third years because I just really wasn't happy with what I was doing. And I almost considered quitting. And luckily, I had some really good mentors and physicians and family and friends who we looked more like, how do you balance medical school, which is really tough, and the things you really want to do in life, and how do you blend that together better? And I'm glad I did, because then once I got into the third year, I was like, oh my gosh, we're seeing patients. I'm working with really smart physicians and nurses and consultants and all those type of things. And it made a really big difference. But that probably was my first episode of burnout, even though I didn't call it that back then. And then I went into a residency in emergency medicine because that was kind of my personality type. I liked fast paced. I liked chaos. I liked working with really smart folks, the nurses, the docs, the paramedics, the consultants, and those things. I felt like I was really helping people in really tough situations. But one of the problems that I see is that most people you meet as a patient in the emergency department are not having a great day. And there's a lot of really tragic things that happen to people. And you might deal with a death of a patient, and then you have to move on because there's people waiting to see you, and you never really process those things very well, and you tend not to deal with them. A lot of times you don't talk about to your family about them either, and these things kind of build up in an unhealthy way that we never really get to learn how to unload a lot of those things. And these things start creeping in, and you get symptoms of burnout. And that's a real problem that we have to do a better job at teaching people that are learning to be doctors and nurses and physicians to deal with those things in a little healthier and better way than what we do now. You know, it probably was my second episode of burnout at that time. And then I moved into doing a fellowship, which I really wanted to do, got back into clinical practice, loved what I did, paid off student loans, which were a huge thing, had become a program director for a fellowship, and eventually a program director for a residency program. But there was this thing in the back of my head that I kept saying, is this it? I always felt like there was something else I needed to do besides just that. And then I started talking to colleagues about it, and I found out that they were burnout. They were very stressed. Colleagues would say, it's Sunday, I'm off, I got to work tomorrow, and I'm very anxious and depressed. People truly had depression. And sadly, two colleagues that I worked with committed suicide. And that makes you really step back and decide, is this the path I want to go down, or is there something else I need to do? So I met my first coach at a conference, had no idea what a coach was. She was a physician that helped other physicians in their careers to transition into other things in medicine or outside of medicine. And we kind of sat down, and I considered private sector and consulting and all these amazing jobs. And she helped me figure out how to, turn a CV into a resume and how to interview for positions and all these things. And then one day she said, "What was the reason that you decided you wanted to do all this?" And I brought up that quote again about, well, who's helping us? Who's helping the helpers? And she said, "Why not you?" So after much thought and debate, that was 7 years ago, I decided to enroll in a coaching program and get really serious about it and finish that up. And now, working with other physicians to look at how do you overcome obstacles in your career? How do you prevent burnout, or how do you overcome it if you already have that? How do you develop leadership skills so that you can move into other roles and things? And I love what I do. I also do speaking. I still do clinical consulting, but it took those episodes of burnout to get me unstuck and to motivate me to do something that I'm doing now, or else I don't think I would have done it before. So this picture, kind of says it all, and I think we're all pretty familiar with this. The doc has their battery drained down to the red zone. They're worried about COVID. They're worried about their patients. They're not sleeping. The clock is moving. They haven't eaten. They haven't spent any time with their family. They've got charting to do and emails to answer. And you just feel like there's not enough time in the day, and you don't have enough energy to that. And when you look right now, it's pretty common for people outside the medical workforce to change jobs and careers. It's not so common when I talk with physicians and doctors, but 50% of physicians right now have true diagnosable burnout. 50% of physicians are rethinking their careers. Do I want to retire early? Do I want to go part-time? Do I want to get out of this altogether? And if so, how do I do that, or where would I even go? If you look, 25% of those people want to make a change in the next year. And when you look at our nursing colleagues, the last study I saw was 43% of them wanted to make a change in the next year, and a quarter of nurse practitioners wanted to make a change within the next 1 to 2 years also, which is very significant. So if all that's taking place, the thing I ask people is, let's look at what your current job or career looks like, and let's look at your ideal career. So put away all the limitations, put away all the things you think are foolish, and identify your ideal career. How many days do you want to work? How many hours do you want to work? How many patients do you want to see, even if or do you want to see patients at all? What do you want to do on your day off? How much vacation do you want to take? What things do you not want to deal with again in a new career that you're dealing with now? And then let's look at your current career and see how those blend together and overlap. If your career looks like this diagram, where you don't have very much overlap, there's a problem. You're probably never going to get to 100%, but wouldn't it be nice to be 50% or 75%? And the question is, how do we get you there? And what does that look like? So why don't physicians do this? Why do doctors stay doing things they don't like? And I think the biggest thing for probably all things that humans do and in any career is fear. It's fear of the unknown. It's fear of lack of stability, lack of income, not knowing where I would go. What do other people think? Status. Oh my gosh, if I leave medicine, I'm not a doctor anymore. Um, but it's also, where would I even start? Very few of us have business skills and are taught business skills in our healthcare professions. But even if you do have those, it's still daunting to figure out, okay, if I decide I want to do this, what do I even look at? Where do I want to go? Some people have some ideas like, I want to go work for a drug company. But a lot of people like myself, I had no idea really which direction I wanted to go. And then if you decide you do want to go, where do you start? What was the first thing I should do? And those type of things. And that's where a coach can really help you. I think the most tragic thing of all, though, is the top picture, the golden handcuffs. Doctors and physicians make really good money, but I know a lot of them that are very miserable. But they will tolerate the things that they're miserable because they make really good money and they have a quote unquote stable job. And that's not just in medicine. I've seen people in really high powered jobs in the tech industry and everything else. And especially if you've got a ton of debt, like a lot of medical students have with $300,000 and $400,000 when they get out of school, and it kind of locks them down into this position. And that's really unfortunate. So when they start working with them, I'm going to ask a lot of questions, but I kind of put it down to 4 or 5 things. And the first thing is, I really am a big fan of Simon Sinek. He's an author and a speaker, and he has a book he calls Find Your Why. And it's basically, why do you get out of bed each morning? Why did you go into the job that you're in? Why do you hang out with the certain people that you hang out with? What is it that makes you you, and why do you do those things? So let's go back to when you applied to medical school. Why did you apply to medical school? What were the things that really attracted you to medicine or into a doctorate of nursing degree or a PharmD degree or being a dentist? What attracted you into that field? What things do you still like about that field? What things do you like to do when you're not working? Because that's really important. What are your hobbies? What do you do on vacation? Where do you go? What do you do? Why do you do that? And let's build up that thing, a picture of you in the positive. Now let's look at the things you don't like, or the things you hate, or the things you just tolerate. I don't like people to say, I hate this, but then look at another job and realize that same thing's going to be there. Now, there might be some things that you're like, you know what, I really don't like this, but I could tolerate that. We can make those less and less, but there's always going to be things that you're going to have to tolerate no matter what. But how can we blend those together in a picture that's more positive for you and something you could really see yourself doing instead of things being more negative? The next step is, who's your support system? Spouse, significant other, friends, family, maybe colleagues. That's getting more prevalent, though years ago, physicians were very reticent to talk to their colleagues about the possibility of changing and going to something else. But that's really important when you're doing this, because you might need some help through this, and who's financially dependent on you. That's really important also. Which brings the last thing, is finances. I tell all my residents, if you haven't got it already, and I think you should do it as soon as you become a doctor, you should get a good financial planner, a good accountant, and then ask them, hey, I'm thinking about transitioning into a new job. How much money do I have? What's my debt? What's my tax burden? What's my savings? Can I make a budget that's smaller? Because many times when you transition into something else, there's going to be a time where you're going to have a decline in income, or maybe no income. I've met people who've quit their jobs already and looking for something else. So how long can you go on that decrease in income or with no income at all? And lastly, how can a coach help? Well, first of all, coaching is a confidential process. So I've had clients say, I've told you this, but I wouldn't tell anybody else that, because it's kind of weird that sometimes people are really embarrassed to share their dreams of what they really want to do. And so with a coaching relationship, that's what we're here for. And then how do you get through this pros and cons and all these options? And it becomes very overwhelming. But then how do you stay accountable and focused to keep moving forward? I put it earlier, like you go to a conference and you learn a great new thing that you want to put into practice, but the next day you go back to work and you're working all day. And the next thing you know, 6 weeks have gone by and you've never got to go back and look at that thing that you wanted to implement. Well, coach can help you be accountable for that and to stay on track to make sure you're moving forward with something in a career transition instead. So, Angela, I think I probably went over, but I'll turn this back over to you.
And not too much. And that was absolutely wonderful information. But now I have a couple of questions for you.
Okay.
So tell me, what opportunities outside of clinical medicine exist for physicians?
Great question. There's so many things out there. Some things are really obvious. Like somebody may say, I'd like to go into leadership and be a chief medical officer at my hospital or a director of my department or my group or something like that. But then there's less obvious things. There are jobs as a consultant in working with the electronic medical record, the companies that do those process, drug development, drug companies, device companies, capital and venture capital analysts, people that are looking to invest into healthcare and need a physician or a doctor or a medical person to help them. What does this stuff mean? There's jobs in government. There's jobs in the media. I have several physicians that I know that are actually expert consultants on media. They get asked when something comes up to help them better understand it and then get that out to the public, because we take really complex things all the time and try to put them in words that our patients understand. And the media is very similar to that also. There's so many jobs in government. There's jobs in education. Maybe you want to teach in medical school, nursing school. Maybe you want to work for a company that does continuing medical education. They're always looking for people. Maybe you're a really good writer or editor, not me, but you want to go out and work for a medical journal or a medical database to help them with content and editing and those type of things. The things are absolutely endless. Many things are very science oriented, but I've seen some physicians that go into careers that seem like they have nothing to do with medicine at all. But as I tell people, remember, these companies often aren't looking for a physician, but they're looking for somebody that has the skill set that you have, that you've learned and honed over years of education and hard work. And that's often what you'll see, instead of like, we're looking for a physician to do this, but it may be the same skills that you have. It just doesn't say physician on the application.
So that actually kind of ties into my next question, which is, what skills do physicians have that they can leverage in a non-clinical career?
That's great. I would say all of them. We have to communicate, and we have to communicate well, not just with patients, but with family members, with our teams that we work with in the hospital or clinical setting, with consultants. So good communication and being able to go up a level, down a level in communication is really helpful. Risk analysis. Every day in medicine, we're looking at how, what is the likelihood of this? What's the risk of this? And being able to communicate that well. With all the chaos and things that we're under in medicine right now, it's not being able to fall apart when stress comes up. Not too many jobs are as stressful as medicine, but it's a great skill set to have. It's like, I know people that, the roof could be falling in the hospital and they'd still be just as calm as can be. And that's a great skill set to have. But leadership, being able to work with people of all different backgrounds and knowledge, skills, and everything like that is super important. And we do that every day. And making decisions quickly, often with very limited information. These are all great skill sets that people can leverage into another career.
Great, thank you so much. I do have a couple of questions from our audience. And the first one is it the job of the coach to suggest ideas to the client, or does the client do the research in regards to different types of career ideas?
That's a great question. So in the coaching model, versus being a mentor or a consultant, we're here to ask you questions because we believe that the client has the answer. It's just uncovering it and peeling away the layers of the onion, so to say, to get to that right answer. It's asking you questions to maybe take you in the direction that you're heading, but not really giving you the answer, because the answer for me may be very different from the answer for you. Once in a while, I have a client who does say, I just absolutely don't know. And that's when I kind of step out of my role and I said, well, can I have your permission to give you maybe some ideas? Like, I may see that they have all these skills and interests, and I think, that fits really well with this job. Do you have any interest in that? But it's still the client that comes up with what they want to do and where they want to go. Our job is just to kind of help them clear away all the red tape and the debris and things and have them get there.
Great. Thank you. It can be easy to get confused on the different roles, so I appreciate that. And here's our next question from the audience. What gets in the way most commonly for physicians who are seeking a change?
That's a great question. Ourselves, we go to school for half of our lives. And the only thing you really get taught is how to take care of patients. It's pretty rare for doctors and physicians to have any type of business classes, though that's changing in other professions. Like my dentist said they have business classes, a chiropractor, massage therapist, nurses are getting business classes. For some reason, we're not getting it that way. And there may be a reason for that. So people often doubt themselves. They're like, all I can do is take care of patients. But again, I remind them of all the skills they have and what else they can do. But it's also being able to take a risk because it is taking a risk to do something different. And how risk averse are you? And sometimes you'll see that in clinical practice. You'll see physicians who are very risk averse and others who aren't so. So I think a lot of times we get in our own way. But the question is if that is happening, then the coach's role is to try to figure out why that's happening and see what the comfort level is there with the client and seeing is there a way that we can overcome that.
Great. Yeah. Well, it looks like we're getting ready to come to the conclusion. So could you give us the take-home points for our viewers today?
Yeah, I think the biggest thing starting off is that when I hear people that say, I don't know how much longer I can do this, that's a big red flag. And I was always a big fan of Steve Jobs, and he had a quote that I'll read here. He said, I've looked in the mirror every morning and asked myself, if today were the last day of my life, would I want to do what I'm about to do today? And whatever the answer has been no for too many days in a row, I know I need to change something. And I think that fits really well with healthcare providers and people who are looking at making some change. And with that, as a doctor and physician, you've got so many skills that you can leverage in another job and career. And though it sounds really cliche, you need to find what you truly love to do because being miserable for 20, 30 years is not great. You deserve better, your friends and family deserve better, and your patients deserve better also. So to be successful in transitioning, you really have to have focus, commitment, and accountability. And a coach can really help you with that and to individualize a plan because what may work for me may not work for Angela or may not work for people in our audience. So it's like, how do we find that individual fit? And a good coach will help you do that.
Heath, thank you so much. You've given us a lot of great information on coaching through a career transition and how it can benefit healthcare professionals. For our viewers, Heath has a free offer to tell you about now.
So yeah, anybody that has any questions, my email address is here. Angela will put those out in the chat, my LinkedIn page, and there's also, I've cleared out some spots on my calendar, and you can just simply click on this link, and it'll take you to my calendar, and you can sign up for a free 30-minute session with me. We can talk about what's on your mind, no matter if it's career transition, leadership, burnout, any of those things. If you're interested in working with me as a coach, that's great also, but there's no obligation for that. It's what are you interested in? Where would you want to go? And I'd love to hear from anybody out there who has any questions or ideas of something that they'd like to change.
Heath, that's great. Thank you so much for that offer for our viewers.
Absolutely.
And everyone, remember you can find a link to our recording on our LinkedIn and YouTube pages, Doctor by Doctor Coaching Group. Also, you can follow us on LinkedIn each week for summaries and polls and articles and more topics yet to come. And finally, you can reach out to us on LinkedIn anytime to ask questions and to give us ideas for future webinars. And as a reminder, our next webinar will be Wednesday, October the 27th at 5 p.m. Our guest will be Dr. David Dull, and he will talk to us about leadership after the pandemic. I'm Dr. Angela Owens, and from everyone at the Doctor by Doctor Coaching Group, we want to thank you for joining us today, and we look forward to seeing you at our next webinar. Stay well and thrive.